City Manager for Morgan Hill. And I want to welcome you to our joint virtual town hall. And it's joint City of Morgan Hill along with the City of Gilroy. So sort of representing South County. And we decided to host this joint town hall to talk about COVID and specifically how we're doing in South County. The county had a press conference recently and really set off the warning to the county about the need for social distancing and masks and so forth, for the county to sort of up the game because numbers weren't looking really good. And so we thought we would in South County, have this forum so that we could share information from the cities and also from the county. And so with that, I want to introduce a couple individuals and we'll have a formal presentation in PowerPoint, and then we'll go ahead and open it up for questions or comments from the communities. So first, I want to introduce Jimmy Forbes. He's the city administrator for the city of Gilroy. He'll turn it back over to me and I'll introduce a few more. Jimmy.
All right. Well, thank you, Christina. And I do want to thank Christina and our friends in Morgan Hill for having us be part of this. As Christina just said, this is a regional, national county. There's no borders. And in South County, we have had certain hotspots that require a little bit more attention than maybe some others. I think this forum is timely because I think from what I've certainly seen and maybe my own experiences is that we may have started to become a little complacent. And as the numbers are starting to show, that's probably the opposite of what we should be doing. So I think you'll really get some good information tonight from the county and from some of our partners to let you know that what could be coming up may be, we may be going back to where we were before, unfortunately, as the numbers continue to rise, not only in our area, but all over the country. So again, thank you to our friends in Morgan Hill for including us, and back to you.
Thank you, Jimmy. So we also have on tonight's town hall several members of the leadership team of Morgan Hill, as we generally do for our town halls. You'll see the video up for Donald Larkin. He's our city attorney. And then from Gilroy, we also have Rochelle Bedell, and she does the communications for the city of Gilroy. And then you're also tonight going to be hearing from Brian Darrow from the county. He's going to be providing part of the presentation tonight and then here to answer any sort of questions. And then I would like to introduce now Maureen Tobin, who's Morgan Hill's Communications and Engagement Director. And I'm going to turn it over to her to start off our formal presentation. Maureen.
Thank you so much, Christina. Let me share my screen here. Excuse me, this is taking a little bit longer than I was expecting. Okay, can everybody see that?
Yes.
Wonderful. Okay, so before we even get started into this, and like Christina mentioned, there are several other people who will be chiming in and sharing information. I'll just be leading us through the presentation and sharing some of it. But we'd like to acknowledge that it's been tough. And I think all of us, if we're honest, are really tired of hearing about COVID-19. We're tired of worrying about it, of thinking about it, of perhaps even having disagreements with our friends or family members about what's right and what's wrong. And so we just thought it'd be nice to acknowledge that as we start off. We certainly, in both cities, are tired of having to think about it. And yet, as Jimmy Forbes said, it's the wrong time to become complacent. As you're going to see in the information we have to share tonight, the numbers are letting us know that we really need to go back to being very stringent in following the protocols. So we're going to cover a little bit about where we are in the county as a whole. We are part of the ecosystem of Santa Clara County, where we are in South County, Gilroy and Morgan Hill, and even San Martin, the importance of testing, And then the big issue ahead of us is celebrating the holidays, and how do you do that safely in the midst of this pandemic? So the county issued a press release and held a press conference, as Christina mentioned, earlier this week, really raising the red flag that there's big concerns about what's happening in relation to COVID. There were significant increases this past week. Most significant was on Sunday. In that one day, we had 350 new COVID cases reported. And that's the highest it's been since July, where we had a real uptick right around the 4th of July time. This last 7-day average has been at about 156, which is up over the last few weeks from around 95 on the average. Hospitalizations have increased by 10%. Oops, excuse me. And then our total cases in the county are now just a little over 27,000, with our total deaths being at 440. And that was as of the update today, this afternoon at 2 o'clock. In relation to the message that the county wanted members of the community to realize about businesses is that there is a county business and enforcement team, and they really are stepping up enforcement with businesses. Each business is required to have a revised social distance protocol on file with the county, and the link below, the sdp.sccgov.org, is a link that they're encouraging community members to check out before they frequent a business, to make sure that they really are following the right protocols. Again, they're asking the community to be aware of what businesses are doing, and if you're concerned that they're not following the right protocols, the link below the second bullet is the place to express your concerns directly to the county so that the enforcement team can take a look at that. The philosophy is, first to educate, not to go out and shut people down and slap fines on them, but to get everybody to be safe. That's the goal. But if a business is non-compliant, then they will institute fines and charge them, and they're not insignificant. I'm going to ask Brian Darrow from the county to step in to talk a little bit about the tiers. This was established by the state, not the county, but that's what we are now following. The red arrow is pointing to moderate, which is where the county of Santa Clara is currently. But Brian, are you ready to jump in and just say a little bit more about the details on this chart?
Sure, yeah. Good evening, everyone. Thank you for being on this call. So just to explain the chart a little bit, as Maureen mentioned, in late August, the state released this new blueprint, which replaced the county monitoring list and created a 4-tier color system for different sort of levels of restrictions that would be applied for that county per state rules related to COVID-19. So a county can have more restrictive rules than the state, but we can't at the county level decide to be less restrictive than the state. So for whatever tier that we're in at a given time. So another way to put that is that the stricter rule always applies. If the state has a stricter rule, then we have to abide by that. If the county has a stricter rule, then that's the rule that applies. So you can see here, tier 1, the purple tier is the most restrictive tier, and that you can see the kind of 2 major metrics that are used to determine which tier you fall in are the adjusted case rate and the positivity rate. So the purple is the most restrictive, yellow is the least restrictive, and you're actually placed in a tier based on the worst of those 2 factors that I mentioned. So if your positivity rate is in the orange tier, but your case rate is in the red tier, you'll be placed in the red tier because that's the stricter of the 2. And we in Santa Clara County, the number that's really been kind of the more critical number for us, we've been stronger on our positivity rate. That's been a better metric for us. And what's been kind of determining where we end up falling has really been the adjusted case rate. Now the adjustment comes from the amount of testing that we do. And that's been very good for Santa Clara County because we do quite a bit of testing here, quite a bit more than other counties. And so there's been two reasons to get tested. Once this framework came out, it was always true that testing, and I know Maureen's going to speak to this, it was always true that that is a critical tool for us to be able to see where the virus is, to be able to have individuals know their status so that they can take appropriate action, they can protect themselves and their family and isolate as needed and tell their contacts to quarantine. And we also, the county of course does case and contact tracing, and we tell their contacts to quarantine too. But that's always been critical. But with the state's framework, it's also critical that we do a lot of testing in order to get this good adjustment on our case rate. And that has been a real benefit to us. The state also has a health equity metric that ensures counties don't move forward on the tier system unless the more disadvantaged communities within that county have similar levels of transmission as the overall county. The basic idea is that you don't leave anyone behind if you're moving forward in a tier, because we know the virus doesn't just stay in one part of the community, it can spread. I know you moved to the next slide, Maureen, and just to call out, so where we currently stand, and this is fairly significant news and was sort of alluded to in the press conference earlier this week. But so Santa Clara County is currently in the orange tier, which we've been in for several weeks now. However, as of Tuesday, the recent spike in cases that our health officer was speaking about placed our metrics into the red tier once again. So our adjusted case rate's now at 4.1 average daily cases per 100,000 residents, and that's anything between 4 and 7 puts you at the red tier. So we're just into the red tier now. It's important to note that for a county to actually move backwards into the red tier in our case, your metrics have to be in that more restrictive tier for 2 consecutive weeks. The thing I'd flag though is that unfortunately, given the rate at which our cases seem to be rising, we really expect that our numbers next Tuesday are going to again place us in the red tier. So we would officially be in the red tier as of next Tuesday. And that has a lot of implications, as I think folks know now, about what activities and businesses are allowed to open. And I can talk a little bit about that if folks are interested or want to talk about that. But that is kind of, I mean, sadly, as we've seen this concerning trend, it has implications for what the state allows us to do. Maureen, did you want to take over the next slide?
I will, thank you. So taking that information about the tiers and about where we are as a county, then we have some information specific to Morgan Hill and Gilroy here in the South County. And what's interesting to note, as you look at the 2 boxes in blue, it tells you the case numbers, and this is for the period of October 4th through October 24th. 45 cases in Morgan Hill, 121 in Gilroy. But when you look at the cases per 100,000, Morgan Hill is actually at 4.1 and Gilroy is at 9. And so if we were tracking things independently by city, which we are not, it's being tracked by the county overall, and it's an average of all the communities, Morgan Hill actually is where the county is now too, and we really are in the red as a community, and Gilroy actually would be in the purple. So I know sometimes there's a sense that in our community, we're doing really well and we're not as impacted as other areas, but those numbers really suggest that we are, and in fact, you know, further south in South County, we're significantly impacted. This map here, and I hope you can see it okay, the real reason I included this is just to give you a sense of the county as a whole. Now, it certainly doesn't, you know, tell us the little details that I just provided for you, but you can see that there are areas, the lighter blue color are areas that are less impacted. They have less rate of cases per 100,000. And so like in Cupertino, very light color, you know, Saratoga, even Sunnyvale and Mountain View are much less than the greater San Jose area, Morgan Hill and Gilroy. And what we do know from information that the county has been able to provide is that the east side of San Jose has a significant hotspot, And down in South County in the Gilroy area, we have a significant hotspot. So those are important things to be aware of. And also to realize is, this is a whole ecosystem. We travel around in and out of other communities. People come into Morgan Hill. And so we have to think of it as a whole too. That kind of moves us into the importance of testing. Brian covered that. And Brian, if I miss something here, please jump right in. But the testing really is important because that's one of the things, as Brian was describing, that is considered in terms of moving in and out of the different tiers. Widespread testing really gives us a sense of how many cases really exist in our different communities. It helps understand where actually is the virus spreading. That's how we know that there are hotspots in Gilroy and in the east side of San Jose. And a big one that I think sometimes we forget about, it certainly doesn't, when you go get a test, it doesn't prevent you from catching COVID, but what it does do is tell you if by chance you don't have any symptoms, and many people can have COVID and not have symptoms. If they get tested, then they can find out that they have COVID and they can take the appropriate steps to quarantine and stay away from places where they could be infecting others. And without the testing, there's really no way to know if you happen to be a person who's just a carrier without symptoms, you might be going around in everything you're doing and infecting other people. So those are really important things to consider and know about. I've got the sccfreetest.org link here. There's testing in both Morgan Hill and Gilroy on a regular basis. Looking at us as a part of the county, South County is this kind of golden color. And there's a little arrow pointing to the red. And so you can see that the rest of the county is the purplish blue color. So South County is a little bit lower in getting testing. Other parts of the county are doing a much better job. East San Jose is even lower than South County in testing rates. So, and we've dropped significantly here at the end of October. So this is an interesting chart to look at and realize that we really need to, as much as we can, step up our opportunities to get tested. The positivity rates here, and another reason why we're continuing to monitor South County and the east side of San Jose. Again, we are in South County, the gold, and that includes Morgan Hill, San Martin, and Gilroy. We have higher positivity rates at 2.49 than the majority of the county. The east side of San Jose is even higher. So another reason that we really need to be keeping testing as a high priority, each of us personally. These are the testing locations down here in South County, both in Morgan Hill and in Gilroy. In Morgan Hill, both sites, the DePaul Health Center and the Morgan Hill Council Chamber require appointments, but it's very easy. You can make those appointments at sccfreetest.org. Down in Gilroy at the South County Annex, which is the Del Bueno Elementary School, that's drop-in. And although each week they post it as if it's a pop-up site, it has been consistently available Tuesday through Friday for I think several months now. And as far as I know, that's not going to be changing. But that's just drop-in. You just show up and get your test. The OptumServe at Gavilan College is another appointment only. And then there have been, there's a lot of other sites. If you happen to work in some area further north, the Fairgrounds has testing. And again, you can jump on the sccfreetest.org and find locations throughout the entire county.
And Maureen, if I could just jump in.
Yeah.
I just want to mention that the tests that they're using now are first of all painless. They're not the ones that go deep inside like the flu test anymore. And the county has really mastered the process in getting people in and out. I've gone to the chamber building multiple times to do it, and you're in and you're out. There's not waiting involved. And I've had the same feedback on the fairgrounds, which Maureen mentioned, and they see thousands of individuals a day. And so I just would encourage everyone to get tested, to tell their friends to get tested. And it's not just a one time and then you're sort of done, but to, consider based upon exposure levels and work and that sort of thing, how often to do it. But once again, totally free, painless, and easy to do.
Yes,
Thanks,
thank you, Christina.
And Maureen, I was hoping to jump in too. This is Brian.
Yes.
Thank you. The one thing I wanted to add, actually a couple things. One is just that we have another testing site in November in Gilroy that's appointment free, so it's just drop in, and that is on the 18th of November at San Ysidro Park from 1 p.m. to 5:30 p.m. So we occasionally have just a day here or a day there where we try to drop in and provide some of our testing resources to a certain part of the community, but that is open to anyone. And then for the Thanksgiving schedule, it's going to be slightly different, at least at the South County Annex. I'm not totally clear on the OptumServe site at this point, but South County will be Monday, Tuesday, Wednesday that week, and then it won't be open on the Thursday, Friday. But the other thing, just those sites have been, and there is no intention of moving the South County Annex. That's a site that we really continue to see a strong need for, although it has a lot of capacity that's not being utilized. So to Christina's point, if folks have gotten tested once and that was a while ago, but you are a frontline worker or you're out in public a lot, the county certainly encourages you, even if you have no symptoms, to get tested again. What we say is, especially for frontline workers, is getting tested monthly is a good strategy, or even every 2 weeks would be just fine, and in fact is probably prudent. And then I think that was all I had. Actually, there was one comment on the previous slide, which that information was a little bit dated, but it tells the story of why the county will be continuing to invest in testing resources. That slide. So actually, our positivity rates just in the last week have gone up quite a bit. I think South County is now over 3%, and East Side has drifted up as well. But this really is part of the story why it's so important for us to be investing resources in South County. So those testing resources are going to be there. So we just encourage folks to take advantage of them.
Thank you so much, Brian. And then finally, we just wanted to share the county's message about celebrating safely. We're coming into, for most people, the biggest holidays of the year. And generally, because of the cooler weather and so forth, it's times when we get together with our families and friends indoors, not outdoors, oftentimes having large parties and just, times for family reunions, things like that. And the reality is, the best recommendation is to celebrate without gathering or traveling this year, which is hard to imagine, celebrating the upcoming holidays without gathering with special friends and our dear family members that we might not get to see all the time. But the county's really emphasizing, and so are we as Morgan Hill and Gilroy, that there's many ways to enjoy the holidays. We've all had to be creative this year about how to stay connected, and the holidays are certainly a time for that. And a reminder that if you're gathering with people from outside your household, the people who live within your home, even if they're family members, but they live in different places, in different homes of their own, that increases the risk of getting COVID-19 and of spreading it, which is a hard thing. I know personally that's hard for me too. I have family in several different locations. If you gather in person, if you make that decision, make sure that you keep it to as small a gathering as possible, short, preferably with a same group of family members that perhaps you've already decided to meet with regularly, and outdoors if at all possible. I know in my family, we have decided that our normal Christmas Eve celebration, which I normally host, is going to be very small this year, and it is going to be outdoors around the fire pit with a little tiny Christmas tree off to the side and some decorations, and very short in the middle of the day. The other piece of this is non-essential travel, including holiday travel, is not recommended at this time. Many of us travel over the holidays. I think oftentimes, particularly the Thanksgiving weekend, is one of the biggest travel times of the year. But while there's no legal restrictions on that, it's definitely the health advice not to do it. If you do, though, it's recommended that you quarantine when you return home for 14 days, especially if your activities while you were out of the area, were riskier and potentially you were exposed. The link at the very bottom, which is a little bit hard to see, does have further information about holiday recommendations, and that is on the county website. Lots of good information there. The county also issued some ideas about how to celebrate safely. I shared a couple things that we're doing in my family, but you can still find ways to enjoy traditions, but maybe it's a little bit different this year. And you can still decorate your home, your yard, put up lights. I know we're kind of all getting tired of these virtual things that we do, but it can be fun to share a virtual meal, and at least it's a way to still connect and see each other. Same with parties, and they're suggesting contests or even preparing meals safely and delivering them and dropping them off, so that if you're the one who makes the yummy apple pies in your family, like I am in mine, make them and deliver them and have that be a surprise. Some drive-in movie venues have opened up. So, attend a holiday movie at a drive-in, something that we thought was going by the wayside, and it's becoming now the thing to do. Anyway, you can see a few of the ideas here, and you may have some of your own, but it's definitely a year to be looking for ways to do the holidays differently, hopefully without gathering for an extreme period of time with just a few number of people. And to kind of bring this to a close, just a reminder about what the protocols are that the county health officer does urge us now to strictly adhere to, just like in the beginning. And the first one is to stay home as much as possible. We're all tired of that, and many of us have gotten a lot more lax about going out and about. And of course, we all are trying to support our local businesses and restaurants, but it's better to stay home. Minimize the people outside your household that you're interacting with. And if you are interacting with others, make sure that you're keeping a minimum of 6 feet distance. That's the minimum. More is better. Always wear your face coverings, and remember that outdoors is always better than indoors. So anything that you can do outdoors is definitely safer. And even though in this moment, we do have some indoor dining available and so forth, it's safer to eat outdoors. It's just that simple. And then, of course, as we've already talked about, get tested and get tested regularly. It is really easy. I'll echo what Christina said as well. My first test was the way up, feels like it's going into your brain test. And that's not how they're doing it. It's just a gentle swab in both your nostrils, very simple. And they really do. The county's done an excellent job of making that a simple and easy process for all. Before I completely end, we've got 2 websites here, but I just also wanted to share, as part of our efforts here in Morgan Hill, we've been pushing a buy local campaign. And as part of that, we've created some fun reminders with the buy local of, staying safe, masking for a friend, stay home if you're not feeling well, stand together by standing 6 feet apart, and good hygiene is in your hands. So we wanted to share those with you, and you'll be seeing them throughout the downtown area, just as a reminder that even as we're trying to support our businesses and our restaurants and buy local, more important than ever, we still have to do that safely and protect each other. So that is the end of our slides. And I guess we'll open it up for questions now, or if there's anyone, Brian, if you wanted to add anything. I see Jim Wyatt joined us, Chief Wyatt from Gilroy. If others wanted to say anything, or do we have some questions to answer, Christina?
Yeah, we have questions that have been typed into the Q&A. And we also have 2 virtual hands that are raised. And if you're calling in from just a regular phone, you can dial *9 and that will raise your hand and we'll be able to call on you that way. So Maureen, should we go ahead and start with the 2 live questions or comments first? And we have Angie who will help us unmute the callers. And so I think the first one is coming from Heather. So if we can go ahead and unmute Heather.
Okay.
Sorry, I didn't have a question. That must have just been accidental.
Oh, great. Thank you, Heather. That's Heather getting
Sorry.
No worries. No worries. That's she's from our library. She's our community librarian here in Morgan Hill. Okay, so the next one is Brian. If we can go ahead and unmute Brian.
Yes, thank you, Christina. This is Brian Faircloth.
Hi, Brian.
And I have a couple of things I'd like to raise. It's great that we have all the data on case rate and testing rate, but we never talk about any mortality rates. So why can't we get data on mortality rates so we know that if you had, 500,000 test positive, but you only had 1 death, we ought to be able to know what that is. Those numbers are available, but for some reason, I never see it on any county charts. And the second thing I'd like to ask is that it's a known fact that people who have gotten COVID and had to be treated have said, 75% of them have said, I wear a mask all the time. So clearly it's almost like we need more data on that. Like the mask is really not a total answer. So those are the couple things that I would like to mention. And if the folks on the call, can talk about the mortality rates and the fact that people who get it say they've been wearing masks. Thank you.
Thank you, Brian. So a couple things, and then I may turn it over to Brian Darrow and then Jim White. I also kind of saw you sort of listening and you might have some things to offer up. So as far as mortality rates go, so the county does have a dashboard with just a wealth of information, and including in that is the number of cases to date that have been in Santa Clara County. And then also available is the number of deaths that we have experienced. And so one can definitely calculate what that rate would be. They have also come out with the deaths by area code, and it provides demographic and all sorts of information on each of the different cases, the age, the gender, and then any other underlying health conditions. And so that data is available. Brian Darrow, anything else to add there about information related to mortality?
No, I think it's a good question, and your answer is how I would answer that. So from doing that math of deaths, we've had 440 deaths and 27,000 plus cases. It's about 1.6% mortality rate. Now, if you look early in the pandemic here, we were doing so much less testing that the mortality rate was far higher. It was probably in the 9 or 10% range early on. That's come down quite a bit as you test more. Obviously, you find more asymptomatic cases, people who are not at risk of death from the virus. But yeah, it's overall throughout the pandemic, it's about 1.6%.
Thank you, Brian. And then as far as the question about mask wearing, that's just one piece of, what the county and the state, for that matter, is recommending and requiring in some cases. But there's other measures that are in place. Jim or Brian, any sort of comments on that about, the importance of mask wearing, and it's not a foolproof thing?
Yeah, I can jump in, but feel free to jump in too, Jim. I get, one slide that Dr. Cody presented recently at a board meeting I thought was pretty helpful in terms of how to think about the interventions to try to reduce transmission risk. It was a slide of Swiss cheese, and it basically her point was that no single intervention is perfect, but when you layer several different interventions together, you can significantly reduce your risk. So wearing face coverings, there is a lot of science on this that it is quite effective. But your point, Brian, is well taken. It's certainly not perfect. So if you want to sort of maximize your protection, it would be wearing masks. It would be moving activities outdoors whenever you can, if there is an activity that involves multiple households. It would be social distancing when you do that. It would be, thinking about just minimizing those number of events or contacts that you have to just the necessary activities. And so as our health officers sort of shift to more of a risk reduction framework, I think that's a useful way to think about things. And even as she's talked about the holidays, the holiday guidance that Maureen went through was actually put forward by 10 different counties. So it's a bunch of health officers coming together, making those recommendations. One of the things they said was, it's, the safest thing is not to gather, but if you are going to gather, here's sort of how you should do it. And if it's a real priority for you to gather, you should think about maybe eliminating some of the other things you might have done that, like get a haircut or, going to the grocery store a number of times, or going out and dining, that kind of thing. So it's sort of make those choices, don't stop your life entirely, right? It's not realistic for everyone. Just reduce it to just sort of the necessary activities.
Thank you, Brian. Jim, anything else to add?
Yeah, in fact, I just went to the CDC site today to look at what they have to say about masks and social distancing and the combination thereof. I totally agree with Brian that it isn't just one thing that we do, it's multiple things. But I would say that the consistency of wearing a mask and is as important as washing your hands. We all know that we're supposed to wash our hands frequently, but some people, when they wear their mask, they wear it improperly. They don't wear it consistently. And even when they do wear it, they may remove it, placing themselves at greater risk if they were around someone who, unbeknownst to them, had COVID. In other words, if you grab a hold of the mask on the front part to take it off, you now contaminated your hands. And if you haven't washed them before you do the next move, you might inadvertently wipe your eye or touch your mouth and get COVID that way. So these are the consistency is what I'm seeing. And I'll say that the stats that we've been maintaining as a fire department, because we deal with this, the more acute cases, we've seen a steady decrease in the severity of cases, and that's a good sign. That's not to mean that we should put our guard down, but it also means that if we're seeing an increase in cases out there, it's more likely due to people not wearing the mask when they should, or not following the recommended procedures of social distancing and who they socialize with. I think that. And now that the holidays are going to be on us within just a week or two, keeping those thoughts in mind as we congregate, that just because someone doesn't instantly show up symptoms doesn't mean they couldn't be potentially infectious to you. And so I'll just use my fire department as an example. Our folks know that to protect themselves against the patients, and thereby protecting the patients against themselves, by regularly masking up and following good infection control protocols. But none of that would work if they went home and they ignored all the other precautions and got infected while they're at home or while shopping or elsewhere, and then brought it back to work. And I can say right now, at least since the beginning of the pandemic, not a single firefighter has been exposed and gotten the disease. I think that speaks volumes of it actually working, that when they're out with their families, they're following good infection control practices. And I think that the population, all of us need to remember those basics still work. it's the same thing that we use to prevent ourselves from getting the flu, and keeping ourselves healthy, eating right, exercise, all those things come into play in building your immune system, in addition to the social distancing and the mask properly mask fitting and taking off the mask appropriately and washing your hands. So like Brian said, it is like Swiss cheese. It's layers, and you open yourself up if you let your guard down. And I'll just say that some of the increases that we're seeing in Gilroy are primarily to the younger population who do have a tendency to ignore the social distancing and the mask fitting. I see more older people, I won't say elderly, older people wearing the mask like they should. And it's, I'm not trying to denigrate any particular group, but I routinely drive around and I do see groups of young folks, and I get it, they want to be with their friends who aren't wearing their masks. So it is important, and it has to be, like I said, consistent.
Thank you. We have Laura Uden. And you can go ahead and unmute.
It got me muted again.
Okay, we can hear you.
Oh, okay. Yes, you pronounced it correctly. I had an appreciation and then two questions. So the appreciation is I've been attending these as much as I can since they started several months ago. And I think you all are doing a fantastic job of keeping us informed, not just about COVID, but during the fires and all of that. It was so helpful, and it really does help keep everybody a lot calmer if we know what's happening. And this is a fantastic communication method, especially since we get to ask questions. So thank you for doing this.
Thank you.
The two questions that I had are, one is I see the listing of sites on the website that show the county sites for testing, the city council and the DePaul Center. I'm wondering, is there any way to get a listing of all the sites that provide testing? I know at one point when I waited in line in a baseball field in San Jose for an hour and a half and didn't get anywhere. I finally looked for other options, and I found testing at the CVS pharmacy. And I hadn't been aware that was available, but I'm not seeing it as a listed site on some of our information. And I think it would be helpful in case we start to get full again, as the cases increase. It might be good to list the other sites, the alternates. So that was one question. And the second is, where do people get tested if they have symptoms? Because I believe that symptomatic people are supposed to go elsewhere. Luckily, I just got a negative test back again. But in case that happens, where do we go for that?
Yeah. Brian, do you want to address that?
Yeah. Thank you for the question, Laura. So first, we talked about adding the CVS sites to our to the sccfreetest.org website, which has it does have the majority of sites, certainly all the sites that are run by the public sector of the county, and then there's a few state-run sites too. But I thought we had added the CVS sites, but I'll double check, and if it's not there, I'll mention that to our testing team. In terms of where to get tested for symptomatic individuals, there's several drive-through sites that are good options. So the fairgrounds, although it's not in South County, does take, so you can schedule an appointment at the same place, sccfreetest.org, and there's that make an appointment button right at the very top. If you click on that, the fairground site, which is open Tuesdays through Saturdays, has a lot of appointments. And so if you have symptoms, it's not a risk at all to go to that site. The Optum Serve site, which is a walk-in site, actually also does accept individuals with symptoms, and they have their nurses are all prepared for that with the full PPE and everything. Which actually our staff at the South County Annex are also prepared, but we do prefer for asymptomatic only at those sites, just because we were having pretty long lines. And because it's a drop-in setup. I think Optum Serve feels comfortable having some symptomatic individuals come because it's appointment-based, and they have it metered out over a 12-hour period. So there's a lot of sort of spacing out that happens there. But those are a couple options for someone who's symptomatic, and you can certainly contact your health provider as well. Actually, DePaul is a drive-through site too. The DePaul Health Center is a drive-through site, so totally appropriate for someone with symptoms. But the county has this testing order in place. So if large healthcare providers are required by law to provide quick access to testing for anyone who is symptomatic. So if you are experiencing COVID-like symptoms, another option is just to call your healthcare provider and try to get in immediately because you have that right.
Great, thank you, Brian. Our next question is from Nikki Carpendale.
Hi, thank you. And thank you so much. Yes, these town councils have really been very, very helpful for all the things we've been dealing with.
Great.
So I just wanted to, I guess, make a comment. You know, people kind of get fixated on the mortality rate, which is the death rate. But I think for COVID, one of the very important things that people need to look at is the morbidity rate, which is basically the illness rate, the associated kind of loss of functional capacity in terms of people being too sick to work, to take care of their families, to go out, and the associated quarantine with that. And one of the things we're seeing with COVID is that people are too ill to work for literally weeks and in some cases months. And that is, I think, where a lot of the really big load of COVID comes. And it also is where the overload on the hospitals comes in terms of people needing, you know, oxygen and support and medication for, in some cases, weeks. And this is where the systems get overloaded. So the death rate is really tragic, but I think in terms of the true effects of COVID on our economy and our way of life, it's the morbidity rate that is really something that people need to look at and understand. Thanks.
Thank you, Nikki. Next, we have Anna Vidalis.
Hi, can you hear me well?
Yes.
Okay, well, this is the first time I'm ever participating in this type of town hall. I really appreciate all the information that is being given, but I think it's important also to include the Hispanic population, because remember, I mean, if we want to get this virus under control, the more people that know what to do, know how things are, you know, and know how to take the precautions, that's the only way we're going to really get this virus under control. So I think it's important that also you do these type of meetings so that Hispanics are aware of everything that's going on.
Anna, thank you. I see a lot of agreement with what you're saying, and so that's something that we'll talk about, both Morgan Hill and Gilroy, to see how we can make that happen, because you're absolutely right. We need to reach out to those that speak Spanish.
Yeah, there's a lot of people that are just, you know, that only speak Spanish, and well, mostly in Gilroy. Morgan Hill, I think it's less, but in Gilroy, there's a lot of people that really don't speak English, and it's important for all of us to be aware and to know how to take precautions.
Absolutely. Thank you. We appreciate that feedback. Next, we have Brittany Sherman.
Good evening, everyone. Can you hear me okay?
Yes.
Excellent. Brittany Sherman, CEO, President for the Morgan Hill Chamber of Commerce. Again, just want to say thank you for all the time, energy, effort, and sacrifice that's gone into all the messaging that's coming out. It's been extremely helpful. My question is more around, during the holidays, there's a lot of sensitivity. It's a very emotional time, a lot of isolation with our senior population. Are there going to be, through the county, any expanded services for counseling or any pop-up or drop-in counseling? Traditionally around the holidays, it's a time where there's an increase in domestic violence and suicides already. So I've compounded with what we're going through with COVID and a potential digression back to the red tier. Are there any of those services that we're looking to expand into the holiday season? Thank you.
Thank you, Brittany. I'm not aware of any additional services that are being provided. I mean, I know that the county already has in place social services and sort of venues for what you're speaking about. Brian, are you aware of anything that the county is doing above and beyond for the holiday?
No, not above and beyond that I'm aware of, but we could send out the some links to resources that are in existence.
Great. And both cities do I believe it's a weekly newsletter in both cities. And so we can consider that for our weekly newsletter. Okay, Brittany, thank you. Next, we have one more live caller, David Dindak.
Okay, guys, you got me now?
Yes.
Okay, once again, I want to echo what everybody said before. You guys are great. We thank you so much for all the information and everything you do for us. I got a two-parter for Brian. First is Cupertino is light blue, and in the county's contact tracing, what is Cupertino doing differently than Eastside, San Jose, Morgan Hill, Gilroy? What are they doing that we could do to mimic, to get into that light blue section? Secondly, as the contact tracing continues, the investigations continue, where are these people that have gone positive, have gotten sick? Where were they? There's been a huge thing against salons, and not against, but salons and restaurants have been impacted a whole bunch. But you go to your beauty salon, you get your haircut, man, you can't even get in the door without filling out the form, and they're very sanitized. So are the restaurants. So it's hard to imagine that it's restaurants / salons that are causing this positiveness. And I would think that they're more likely a super spreader is going to be in a box store or in a grocery store. So those are my two questions. Where are the people contracting this stuff, and what can we do to mimic Cupertino and bring the numbers down?
Great questions, David. Brian, any intel to offer, David?
Yeah, I'll take a crack at that. Thanks, David, for the question. The thing with Cupertino, it's what's tough about looking at an individual city, especially a small city, is that it's always important to note that just because you live in a certain city or zip code, it doesn't tell us where you acquired the virus. And so I'm not aware of anything we've observed through our CICT, our case investigation and contact tracing process, that's revealed anything special that Cupertino's doing, but just a couple of observations about that community as compared to maybe Gilroy or East San Jose. I think when you think about essential workers and who's been out working in the community for a longer time throughout this pandemic, it's I think Cupertino's probably got quite a few less folks who are working and with jobs that are in direct interaction with the public in a consistent way, and that's more true of those communities that we've seen that are more heavily impacted. We did do, through our CICT process, we've looked, we've tried to better understand kind of how transmission's happening, and we're doing an even deeper dive on that. But I mean, a couple of things that came out of some of the kind of analysis we did of that work. And the thing with CICT is a lot of it is focused on looking forward. It's focused on finding the individuals who you've had contact with, and then trying to make sure that you let those individuals know that they are now at risk, as opposed to a truly deep dive on how you exactly got the virus. That said, we have been trying to glean what we can, and essentially what we've learned from looking at this is that transmission occurs a lot in households. It occurs at work. It occurs when folks are carpooling. We've learned that once it is introduced into a household, it can spread fairly quickly. We know that there is some kind of incorrect perception that the level of risk when you're around relatives or friends is lower, which is not true if they're folks outside of your household. We learned that transmission really has sometimes a lot to do with letting your guard down. And then, some precautions being taken at social gatherings, but not all. So that's sort of another feature of letting your guard down. But it's a mixture of things. And, what's hard is that I don't think we can look just at our CICT process and tell the full story. So we're certainly relying also on the national, the science that's happening nationally and globally, and just even some of the stories that come out that aren't scientific experiments, but you learn that certain activities have been riskier. But we're trying. I know our health officer is much more up to speed on all of this, but those are some of the things I'm aware of.
Great, thank you, Brian. So we're almost at 6:30, and we do have quite a few questions in the Q&A. And so what I'm going to ask is, if you've asked a question and you would like a response and we don't get to your question, can you go back into the Q&A and just, if you're comfortable, just leave your email address and we will reach back out with responses to your questions. But we do have time for a few more. So Maureen, if you could kind of help me kind of scan through these. I think based on looking at them, some of them we've actually covered already. I think this first one we can talk about, anonymous attendee. What are we doing for people who are homeless in our South County community? We can touch on that. And so as far as if somebody's homeless, there are resources out there. And so the county is partnering with agencies, with many of the agencies. And so if you reach out to the city or to the county, there are shelter resources available as well as food resources available. Jimmy, do you want to touch on that at all for Gilroy? Like, what is the best contact if somebody comes across someone in need of resources?
Yes, we do. We do have a number that you can call it, get you directly into the city, to City Hall. And it's actually on the county's website. So I'm sorry, I can't remember it off the top of my head, but it does have a list of every city and everywhere to get resources. If you look at the county website, Brian, do you know off the top of your head what that website is? Because I'm sorry, I just forget.
I mean, it might be our Office of Supportive Housing. Let me double check while we answer a couple of them.
Certainly, great. Okay, Maureen, did you identify any other questions that we should address right now? Someone said trying to make an appointment for testing in Morgan Hill and not able to make an online appointment. So if you go to that website that Maureen put up there on the presentation, I believe it's sccfreetest.org. What you do is you select where you want to do the test, and then they run you through a series of questions. You have to give an email address, and then what they do is they send you an email, and then you can go ahead and book the appointment. There's a series of questions. It does ask for insurance information. But you can book it without the insurance information, and then they give you a little a code. And so when you go there, you show the code, and it's pretty straightforward. But go ahead and enter your email if you continue to have issues, and we'll reach out with some more information. Let's see, how much time does it take to get the test results? So I think typically what they're telling you when you get a test done is 2 to 4 days. And I think the time is getting shorter, faster turnaround time. Let's see, today's Thursday. I took a test on Tuesday, and about 7 o'clock this morning, Thursday, I received the results, and they send it to you via text if you provide a cell number, and they also do it via email. Now, if your test result is positive, you're going to get a phone call, and it happens usually within 24 hours. There was a question, will Santa Clara County be moving back to red tier this next week? Brian, do you want to kind of go back to the tiers and provide any more insight on that?
Yeah, I think we think that's very likely, just based on the trend that we've seen and how fast the cases were rising. I mean, in October we were seeing just sort of a slow drifting up for a few weeks. Really last week where things started to have a surge, and the state's data is based on a 7-day lag. So the data that they're going to be looking at is already in the books for next Tuesday. So, and it just seems like the way that the trend was headed, it's very likely, but we won't know for certain until Tuesday.
Okay, someone from our housing department sent me information. The homeless hotline that any homeless person can call is, and I'm just going to go ahead and read this out. It's 408-278-6420. The Armory in Gilroy is opening up on November the 16th, and that is 24/7 through the middle of April. Dogs are allowed and storage of items, and this is new this year. And also we're working on getting an inclement weather shelter open as soon as possible as well. Okay, and somebody commented that Gavilan College is doing symptomatic testing.
Hey, Christina, I just wanted to add something on the Armory. It is a reduced capacity this year. It normally holds around 120. They are limiting it to 75. So if you are interested in that service, I would not, I'd get on it quickly because they are going to have a reduced capacity.
Great, thank you. Thank you so much. Okay, and I'm seeing email addresses being added. I appreciate that. And Angie, if you can help me capture all of these questions and comments, and so we can get back to people as we can. And I just want to see if Brian, Jim, or others for that matter have any final remarks that they want to share with the group.
I guess I would just say a big thank you to everyone for, I think, what we've seen across the country is some really dark days with COVID, and quite a bit worse, frankly, than what's happening now. I think what alarms us is that we are on the upswing and we're headed to winter and the holidays, and that is very concerning. But I think given that we were the epicenter of the epidemic in the country, us and King County, basically, because of the sacrifice of our residents and because of the sacrifice of our businesses, we've been able to keep the virus relatively at bay at time, especially for stretches of time. And so I just want to thank folks for, this is a terrible year and it's an unprecedented situation, but I think our residents have really stepped up and protected each other based on their actions. So thank you.
Thank you, Brian. Anything else, Maureen? Okay, so I'm guessing based on our attendance tonight, well-attended meeting, that most of you subscribe to the newsletters and the email blasts that both cities put out. But if not, I highly encourage you to subscribe to the newsletters. In addition to that, Santa Clara County Public Health, I would like them on Facebook and other forms of social media. And you get notified when they're doing press conferences, so you can stay abreast of the latest information. And so with that, we want to thank you for joining us tonight for this joint town hall, and just want to encourage everyone to just keep at it and share this information with friends and relatives, and have a great rest of the evening. Thank you.